What's going on, everybody? Welcome back to another episode of the GSD Podcast. Well, we get so often to talk about all the transformation, all the cool things that are happening within state government. I am pumped about our episode today because we get to have in one of the most central agencies of the entire state that is really just in the trenches, the State Department of Health. And we have the Interim Commissioner of Health, Keith Reed, with us today. Keith, thank you so much for being on the show.
Well, thanks for having me. Appreciate it.
Well, like I said, so much is going on. Obviously, the last, 2 years, I guess.
Almost 2 years.
Goodness gracious.
Feels like 10.
2 years going on 10 years, right.
We need like a picture of you when all of this started.
Although
it's like when
after.
presidents, when their hair gets gray.
I have aged, I got to tell you. I would like to claim that I had a lot of hair 2 years ago, but I can't quite go that far.
Well, seriously, though, 2 years, year and 8 months or whatever, how long ago it was, it's really a lot changed for the Department of Health. All that you guys were doing. You've always interfaced with the public and serving Oklahomans, but things just got turned up big time for you guys. Can you tell us a little bit about, just rewind a little bit, tell us about what it was like whenever you guys just walked into the pandemic at that time?
How you got your role. I mean, what did you walk into?
Yeah, that's a very interesting question because I've been with the agency 19 years. When I first came with the agency, we started talking about plans for pandemic response, primarily pandemic flu.
Really?
We talked a lot about emergency preparedness. So that's always been a focus of the agency. But I got to tell you, it doesn't, all that planning, the tabletop exercise, doesn't compare to the real thing. When we did all our planning with a lot of partners, we put specific plans together, bound, ready on the shelf to go. A lot of the things that happened were not in the plan. They talk about that. Your plans don't survive the first shot. It's time to change as soon as things get started. Yeah, we experienced that.
Really?
Well, we didn't really plan that we were going to have a worldwide disruption in manufacturing. That really wasn't something we looked at. In all of our plans, the personal protective equipment, PPE, that was supposed to be provided by the Strategic National Stockpile, which is a federal resource. That's how we kind of planned for that if we didn't have local resources or state resources, these federal resources would come in, and that would meet that need. And we didn't realize that what was out there in the SNS, much of it was expired. And it wasn't ready to go, wasn't good to go. So early on, just from day one, when we realized that we had a deficiency in our protective equipment, that's when things got started and got hairy.
I remember that too. I mean, there was pretty much a call for people not to buy the N95 masks because
to donate them.
Well, yeah, whenever people were saying medical professionals need this immediately because they're on the front lines, and it seems so far away now just because I think I have a token mask in every pocket I walk into to prepare to go into a store or the supermarket, whatever. But that takes me a far ways back. And so you all, with the supply chain issues early on, had to navigate that. I think there were some emergency orders put in place to ease that. And so government was very effective and, rather than waiting weeks and weeks and months, knew that they had to take action immediately.
The other thing that was interesting around that topic was we were competing with other states for the limited supplies that were out there. Most of the supplies in this area came from China. Yeah. Well, where did the pandemic start? In China. So that's one reason that we had such a issue with the manufacturing. But we were competing with other states trying to get supplies brought into the state. New York, if I recall right, actually chartered a plane to go over and pick up supplies because you could make arrangements to get the supplies, but that wouldn't guarantee they would get here.
There. Yep.
It was a lot of challenge. Then you had the whole challenge with getting testing supplies, which was an exercise in tracking down bottlenecks. We would first it would be the reagents we needed for the supplies. Then we would get those and we wouldn't have the swabs we needed to collect the specimens, or the medium we needed to transport the specimens. It was just one challenge after another logistically for the pandemic. And really that flowed all the way through the early parts and is what really got us on our toes preparing for the vaccination rollout.
Right.
And out of that, we saw a lot of public-private partnerships, right?
Absolutely.
So Emmy Labs, I lived down in Norman, was something that really stuck out because you saw people coming together just to serve a greater need. It was like everyone all of a sudden had this humanitarian effort, and the world banded together. It got really, there were definitely peaks and valleys, but that was one of the brighter moments where everyone kind of felt like, okay, we can do this.
Absolutely. Those partnerships were incredible. We still partner with Emmy today. And one of the things we learned as an agency is how valuable that partnership is, how valuable that perspective is. I'll give you an example. For Emmy, I think you're probably all aware of when Emmy set up the vaccination clinics, the pods where they could do 10,000 people at a time. Well, we have been planning vaccination pods for nearly a decade. They took a totally different look of how to do that and added a lot more capacity, which we hadn't really thought of in our planning. So it's just the value of that partnership. And then in that case, our local health department worked with them, and boom, you set up an opportunity to vaccinate 10,000 people in one day. I mean, it's amazing the way we've been able to leverage those partnerships, and that's really what's made a lot possible for Oklahoma.
So you guys, you mentioned right there just one example of how you had made the plans before, but it's different being in it and then making the adjustments while you're actually exercising that service. Looking at this now from this perspective, nearly 2 years later, that's just crazy to say, but nearly 2 years later, do you feel like adjustments have been made to moving forward, like with PPE, stockpiles and things like that, that we could be possibly better prepared for an eventual possible next scenario that could come to the state?
Well, first of all, Lord forbid that we have another pandemic in our lifetime. But yes, we're absolutely better prepared now, and we'll be even better prepared moving forward.
Wow.
PPE, we have a great stockpile of PPE. We're working on our plans to be able to rotate that stock out.
So it doesn't expire?
Because it doesn't expire.
Gotcha.
Exactly. If you buy enough now for the next pandemic, you can't sit on it until the next pandemic gets here. You'll be in the same boat we were in before.
It's like cleaning out your storm shelter every year. You've got to just make sure every season,
Exactly. That's exactly right. So we've learned a lot about what worked and what didn't work. We're pulling that together in after action reports, and of course we're still in the middle of the pandemic. We're not out of it yet, but we're continuing to learn, prepare for the next pandemic or the next emergency in general. We're learning a lot about our operations as an agency. There's nothing to teach you about yourself like putting a lot of stress on your system. And the pandemic has done that. Put a lot of stress on the system. So that's been a great opportunity for us to learn about ourselves, learn what worked and what has not worked, and then own that and go through a process of improvement there.
So tell us a little bit more about that. Like you mentioned the stresses that of the processes, of setups, of just the organizational aspect of providing these services. What are some specific areas where you identified something and an adjustment has been made?
Sure. I mean, procurement processes, for example. We had to get PPE and a lot of those things we talked about. We had to procure those in very short order. So we learned that our processes weren't as agile as we needed them to be. We learned that there were a lot of barriers within our internal processes. We weren't able to be as agile as an organization as we needed to be to respond rapidly to the needs of the public. So looking at our internal processes, our business operations, those were where we found a lot of opportunities that we could make change. And then recognizing that those business processes are what support the rest of the agency as they execute the mission. So one of our priority areas moving forward is to strengthen the core of the agency, going through and looking at years and years of processes and really peeling back the layers that comes with years and years of working in state government, peeling back the various interpretations you may have, maybe some ways in which people have tried to make the system more efficient, but they didn't adapt as new changes came on board. So really trying to peel back everything to the core and start fresh. Let's create a efficient, effective process that will help serve the organization so that we can serve the public.
And I know that you'd said pandemic's not over. I don't think any of us can forget. I mean, it's kind of one of those modes where you hear someone cough or you think like, okay, what's going on? You kind of like clench up in your chair.
Sure.
But what is on that horizon? I think so many Oklahomans are wondering, what is Omicron going to bring with it? Especially because it hasn't been identified yet in Oklahoma at this time of filming in late December, ahead of Christmas, because we'll share this in January.
Sure.
So, that could all change. But what is on the horizon? What do you think's still out there?
Well, it's a great question. We've certainly learned from COVID and the pandemic that there are variants that'll come on board. The virus evolves, it mutates, it changes. So I think really to be able to prepare and adjust to that, I think that's the natural evolution of a virus. Omicron, it will be interesting to see the data on it. We know now that it appears to be much more transmissible than what we saw with even the Delta variant, which was much more transmissible than the original wild virus. So more transmissible doesn't necessarily mean it's more dangerous, though. Early anecdotal information, and as you mentioned, that's what we know now before Christmas in December, is that it appears as if it's not as severe. It doesn't create as severe a case of COVID. So our hope is that if Omicron becomes our dominant strain, we will see less of an impact on the hospital system. So that's really important to note, because that's really the difference between a pandemic situation and an endemic situation. In a pandemic, you've got something that is really stressing out your medical system and putting people at risk from that standpoint.
Okay.
We're all familiar with the stories of people who couldn't get care in a hospital for routine type of events. Heart conditions or maybe surgeries or other things, because the hospital was stressed due to COVID. So if we can decrease the stress on the hospitals with COVID, even though we'll likely still have the COVID continue with the other variants, it won't be a case of pandemic. It'll be more endemic in nature. We'll have COVID in the community, but we can live with it because it's not creating that amount of stress on our medical system and putting people at risk.
I'm all about real news, too. No fake news here on our podcast. But, being vaccinated, does that seem to have an effect on the Omicron virus?
Well, we don't really know yet. The data is still out there. So, being very real about it, what it does appear to do is continue to decrease the risk of severe illness or hospitalization or death. And that's really what's important when you talk about a vaccine.
Right.
Is the vaccine isn't necessarily going to stop you from coming down with COVID. The plan would be that your immune system is already primed and ready to respond when you contract COVID. So you get a rapid response and you stop it before it progresses to moderate or severe illness and therefore hospitalization or ultimately and unfortunately death.
And we're at the point now where everyone, I think, can get a booster. And then pediatric ages, what are the ages people can get vaccinated for their kids?
So it starts at 5. 5 to 11 is the most recent group that has been approved. That's with Pfizer vaccine. And anyone 11 and up can get a booster dose if it's been at least 6 months past the completion of the series. So if you got Moderna or Pfizer at 180 days or 6 months after you completed that series, you'd be eligible for that booster dose. If you got Johnson & Johnson, it's 2 months after you finished that. That was a one-dose series.
Right.
And then we're really recommending, if you had Johnson & Johnson, best scenario is you get boosted with either Moderna or Pfizer.
That's
Gotcha.
awesome.
I'm trying to get all the tips before Christmas and call up the fam.
Yeah.
So one of the things before we started recording that I was just curious about, because you just kind of mentioned it in passing, was that you're taking a deep look in your role now as interim commissioner of the agency itself, right? And how do you move forward now as an agency? And one of the things you said you're even looking at is the vision statement itself, the mission statement of the organization, of Department of Health. So tell us a little bit about that. What's kind of your thinking there? What's the direction you guys are going?
Sure. We're looking at a total transformation of our agency.
Wow. Okay.
And that's something I would say that we needed to look at even before the pandemic.
Okay.
But the pandemic, stress in the system certainly brought a lot more details to light. We've worked with a consulting agency to help us take a look at these different processes, our organizational structure, what is keeping us from being the agency Oklahoma deserves.
Wow,
That's what we focused on. Our vision statement has been creating a state of health, and the new statement is going to be leading Oklahomans to prosperity through health, and really trying to tie in the fact that prosperity is what Oklahomans are looking for. Health can be an important part of that. So we're looking at all aspects of the organization. I mentioned strengthening the core. That's what we're really looking at, how we operate as a business, how we function as a business, because you got to be efficient and effective to be able to support your mission and to be a good partner to those private sector organizations that we work with. And then we want to manage our portfolio. We want to make sure that we are doing what we should be doing to support public health, and we don't let mission creep come in and get us off track. And then
so what do you mean? What do you mean by that? Just real quick, what mission creep? Tell me.
Well, it's easy when, as a state agency, you have a lot of funding opportunities that come down from the federal government.
Oh, okay, yes.
So we need to evaluate those. Is that right for us as the health agency?
Okay.
Maybe it's something that's right for DHS.
So staying true to your mission.
Staying true to the mission. That's
okay.
Exactly
I love
what
that.
It is.
Oh, that's something OMES has also been making sure that we're staying true to our mission. So that's something I'm very familiar with also. Yeah.
You got to focus
Can you
those
tell what
resources.
It is? Yeah.
Get stuff done.
That's
I love
right,
it.
man.
I love it.
Steve always likes to say, get stuff done and break glass. Just go serve. Right?
Absolutely.
And it
I love
sounds
it.
very similar to what you're talking about with
that's
y'all's
it.
processes. Don't be afraid to break glass.
Absolutely.
Yeah.
There's a third part of it I really want to mention
Yeah.
that I think is so important. It's innovate in public health. And in order to innovate in
key
public
thing,
health,
yeah.
first of all, we got to have our business
Partnerships?
together.
Okay.
We have to have our processes together. We have to be able to support the organization, right? And then we got to make sure that we're doing public health, so we're managing that portfolio. But if we want to innovate, we need to get on the leading edge of public health. I feel like too long now we've been on the trailing edge of public health. That means we got to update our systems, partnering with OMES, make sure our systems are updated so that we have current data. We are organizing our information. Information management is such a challenge. So we got to innovate in that way, but we also have to be able to identify opportunities to do public health in rural Oklahoma and to really innovate in such a way that we're impacting Oklahomans where they live.
And when you talk about organizing data, that could be anything from, hey, we're seeing this happening in some geographical area. Whenever you make data matter and serve the people, that's when you start realizing trends. So for people that don't really understand, like, oh, what could be the big deal there? It could make the whole difference.
Well, and another thing there is when you start utilizing that, that's where the customer or the Oklahoman really starts seeing the difference, right, in their services and things like that.
Exactly.
So, like for the Oklahoman who's at home listening to this, like what can they anticipate changing as far as their interaction with Department of Health?
Well, I think the big thing is for us is to make sure that we're tailoring what we do in public health to the needs of the area.
Okay.
What Guyman needs is not necessarily the same thing as what Idabel needs.
Yeah.
And that's where getting that data and being able to parse that out by location, by area, to really understand what are the health impacts in those particular areas. One of the initiatives we're pushing right now is community health workers. And community health workers are a group that can get out and interact with community members that may be having health issues, may have been frequenting the hospital, the ERs. It's working with them to follow up on their health needs after they get out of the hospital.
Love that.
To make sure are they getting their prescriptions filled? Are they taking those medications? Are they keeping those follow-up appointments? Are they having problems linking to certain medical services and really providing that support to help individuals there?
That sounds really,
example.
because it's the offensive kind of, or offensive, I guess, way of approaching public health, right?
Exactly.
It's making sure those
Proactive
citizens
instead of reactive.
I love that.
And that's just an example of what we're doing. We also have mobile health units that we
I've
have
heard about
around the
this.
state
Yes,
now.
this sounds really cool.
And
Yeah.
we're going to incorporate the community health worker with those mobile health units, but we want to get some of those preventive services out there to rural Oklahoma. We want to evaluate the communities and see what their needs are. If they are lacking in certain services, we want to try to fill that gap. But in the long term, we want to work with that community to get permanent solutions in those areas. So it's really about interacting with those communities to identify their needs.
And those would not be health employees, correct? Those would actually be partnerships with other organizations. Is that
Both.
correct? Really?
They would be
Okay.
both. So like we can go in and start with health employees to kind of fill the gap while we work with the community to get more permanent solutions with those other partners.
That is
out
great.
there. We're not looking to get into a competitive space in these communities to provide these health services. We just want to fill the gap and work with the community so that they can get those permanent solutions.
I think about something that Commissioner Carrie Slatton Hodges said when she was on the podcast, but we focus so much about the pandemic right now because it's our everyday and what we're going through, but you all have other initiatives that need to be accomplished beyond that. And so what she had brought up was Oklahoma historically has suffered obesity issues and some other mental health issues. And so she had talked about addiction specifically, but where you're at, it's like even after the pandemic, there's so much work to be done to getting Oklahomans to that prosperity. So when you talk about that, I'm sure you're like, okay, I'd like to talk about other things besides the pandemic. This is eating up.
Nailed that.
Well, it's eating up your time, and rightfully so. But are there other priorities on the horizon that we as Oklahoma really need to look at for the future?
That's a good question. Yeah.
Well, COVID will pass. It will. Just like flu and everything else did. It just doesn't feel like that right now.
That's exactly
but
right.
For a state of health, to get us to where we need to be, aside from COVID, what do we need to be concerned about as citizens?
There are many issues. Unfortunately, Oklahoma has been ranked around 46th, 47th in health outcomes for many years now. We've got to turn that tide. That's the reason we talk about, we want to get our public health agency on the leading edge of public health instead of that trailing edge. But you mentioned obesity. Obesity remains a serious issue in Oklahoma. Tobacco use still remains a serious issue. Mental health issues are there. We consider that a part of public health as well, and we always value our partnership with Department of Mental Health and Substance Abuse Services in that area. I think, I tell you what scares me is looking ahead. Let's say 5 years down the road, we're going to look back at this period of time during the pandemic, and we're going to see the big impact of those health issues. They're going to be pretty big blips on the screen when we look at what happened with health over this period of time. We've had people that have delayed screenings. So you have the concerns about increases in cancer, heart health. There's just a lot of issues out there that we work with Oklahomans on to try to keep up with through, take care of yourself, get your screenings when it's scheduled.
Right.
The pandemic has put a lot of that stuff on hold. I really worry about the impact. I worry about the impact on kids, the impact when we pull kids out of that environment where they're able to interact with other kids, that psychosocial impact of the pandemic on that. I think we're going to see impacts from that. So it worries me on what we've seen on the pandemic, but it's another reason that we need to stay focused, moving ahead, and really lean into those kind of issues and those problems so that we can address them for Oklahoma.
We should change the topic about kids before I get misty-eyed.
I
know, I'm just, because I do feel that, right? So we've been thinking about, we have a little girl, and I was like, she's only grown up seeing people wear masks. Is she going to read lips the same? Like when everyone takes them off, like, is there a language barrier that you think like, okay, she'll catch up, but it's real beyond that whenever you think like just saying hi to people in a store or going to the family gathering. So I think that's probably part of public health that we'll see more people experience, and certainly on the mental health side. So I'm glad you all are working together because it's going to take an army to tackle these problems.
Absolutely.
Well, and you mentioned an army, so I do want to give a shout out to not your team, to you specifically, Keith, because the amount of hours that you and your team have worked over the last year and a half or 2 years is off the charts, and people don't see that. People don't realize that.
You guys don't sleep, right? Like,
I don't think you've slept in 2 years. Is that right? Yeah.
Well, I'll tell you what. Early on, I tell you, there were people that were literally working around the clock and still are, and I appreciate that, and I would accept that on behalf of the staff because our staff has worked so hard.
Unbelievable.
And you're right. The public doesn't realize it and don't necessarily need to be concerned about that. But the reality is there's a lot of work, a lot of man hours, a lot of sweat that goes into producing the data, the numbers. Out in our county health departments, all the work around rolling out vaccines and provide testing for the public. We're a year into the vaccination program. Over 5 million vaccines been given in the state. Now, that's not just the health department by any means. That's through our partners and some fantastic partners at that. But we have had people at the health department has been directing a lot of that traffic and moving that vaccine and working with our federal partners to get that inventory in and then reallocated across the state So there's just been an incredible amount of work, and my hat's off to our staff. They've just been amazing through this, and it's been draining. They have sacrificed a great deal of time with their families, and they keep coming back. Public health people are very committed, and they kind of lead with their heart. And this has been an opportunity for them to make a difference. And I keep reminding them, usually in public health, when we talk about saving lives, we talk about years down the road. For us, it's about increasing the quality of life and the years of life.
Right.
We look at it that way. In this particular instance with this pandemic, I always want to remind staff, rolling out vaccinations and things like that, you have literally saved lives in real time compared to what we normally do in public health. So, I can't say enough good things about what our public health staff has done through this past 2 years.
Pretty sure you all did something revolutionary. I saw it on your Facebook recently that said Oklahoma was like one of the first to really get their vaccination program up and running. So, and it's stuff like that you don't often hear about, because when you're just living in this, little area, you don't think beyond your borders. But I do. Those are mission moments that you all just pull your boots up and go to work. So everyone that works over at OSDH, truly thank you for everything you do, because I think originally all of us thought, let's flatten the curve within 30 days, and here we are 2 years later, and the rest of us are waiting to move on with life, but y'all are living it every day.
You mentioned the vaccine rollout. I do want to point out, because that was a pretty incredible feat. If you look at it now, where we compare, people look at how Oklahoma compares to the rest of the country on the vaccination percentage, and we're in the 30s, typically 37, something like that. But in those early days, especially when we were getting vaccine to our 65 plus, the most vulnerable population we had, the ones that were most disproportionately impacted and at risk, we were ranked, top 6, top 7. Across the country on getting the vaccine out to them. So while we had that group that was at greatest risk and at greatest need, we were there, we were getting it to them. Now, granted, we hit a wall later on, but that wasn't necessarily due to the efforts of staff. That's Oklahoma. And we understand that people have strong opinions about the vaccine. They have their personal decision they're going to make, and we respect that. Right. Our goal has always been just to keep it available, keep pushing it out there, keep the information out there. Let Oklahomans make their decision, and we'll be there to provide it when they're ready.
I love that, Keith. That's awesome. And so thank you again for not only coming on the show here, but just what you do for Oklahoma. Honestly, it goes. You just do a lot that people don't even recognize. So thank you very much for all you. And another staffer I said I was going to give a shout out to is Jackie Shawnee. She was supposed to join us here today, but she got sick. So got to give her a shout out. So
absolutely, working hard.
Well, thank you again for coming on the show here. And we have so much more that we can talk about that I want to talk about, specifically around the advancements within the agency that you guys are making. I'd love here in just a few months, maybe we do a check-in, bring you back on the episode, talk about what progress has been made, at that checkpoint. So
COVID's over. Can we just put it on the calendar now?
Yes, please.
We'll plan a whole episode around not talking about COVID. How about that? Would you appreciate that?
Fantastic.
Okay. That'll be the non-COVID episode for you guys.
Perfect.
Well, thank you again for coming on the show. And guys, thank you so much again for tuning in and for listening to the show here. Again, it's such an honor to be able to talk about the progress and what's happening in our state government, especially over the last 2 years. We talk about the downsides of the pandemic, and you can't diminish that. But the progress also that's been alongside that at health, at OMS, at a ton of other agencies that's come alongside that can't go unmentioned either. So I'm glad we get to talk about that also.
And just think a healthcare worker, if you see them, they probably need the encouragement, because they see this every day while the rest of us can try to get back to normal. It's not their normal yet. So I would say, just like you would encourage your teacher who's dealing with the kids in class, they need the encouragement too.
Absolutely.
Well, be sure to like and share this video, and I guess we'll see you again on the next episode of the GSD Podcast. Thanks, guys.
See ya.
Thanks.